We were given some national funding which supported the recruitment of 2 workers who are employed by Pentreath Industries, which is a third sector organisation. But actually those workers are co-located with the early intervention team, and what those workers do is they provide, again, a non-medical approach, but making sure that the young person has access to education, sometimes remains in education, which is clearly important, but also in terms of looking at jobs and voluntary sector opportunities. And what they have done is they've freed up, I believe, the clinicians' time in terms of them providing social support to the individual whilst ensuring that the clinicians can deliver clinical and therapeutic intervention.
Wherever they want to see us, we see people in coffee shops or grandparents' houses, out in fields sometimes, just sitting in our cars. These are all the ways we have to adapt to working in a rural patch.
It's just about us trying to find different ways to ensure that people attend appointments. That's the only difficulty that I can see. And again, one way we can do that is actually contact by text or by phone, again on the actual day of the assessment, to encourage people to come and know that we're not a scary service and that we just want to be there to help.
I think our main thing is the psychological therapies and the ability to improve access for everybody across the county.
What I'm really looking forward to is being able to really expand the family intervention model, and I've got real interest in open dialogue practice as well, and actually I think that would be something that I'd really like to be able to develop and link that with the family intervention work.
The money that will be coming in soon, again, that's going to really make a difference in building up more skills and enhancing on the skills that we've already got, especially around psychological therapies, family intervention. That would be really beneficial for the team.
We can go a lot further though in terms of ensuring that other teams and practitioners become more aware of signs and symptoms of early psychosis.
We've got kind of, working with people with that risk mental stage, being able to offer a kind of coherent service to them, and to be able to extend our age range so that we no longer have a cut-off at 35, but we become an ageless service. And I think the challenge is about being able to keep the whole team together, not to ask people to make too many changes all at once, because I think that's very destabilising for the team. So I think it's being able to kind of all stick together, and the opportunity to be able to deliver things in a much more staged and controlled way would be really, really welcome.
We've all been issued with laptops. That can be helpful as well, so that we don't have to keep going back to the office at the end of the day.
Reduce how many pieces of paperwork we have to complete per client. Just kind of keep it to a minimum that's relevant to the person that you see.
Changing the network coverage would be absolutely fantastic. We have tried moving around and going to different network providers to see where we get a better signal, but there is always pockets of where there's no signals.
More staff would help, but you'd have the same amount of distance covered. I suppose it'd just be split up between more people.
We've gone to advert for 2 Band 7 psychological therapists. Our difficulty is recruiting into those posts, but we have a plan. I think it's a really exciting opportunity for early intervention services.
It's my aspiration, and also the team that I work with in the clinical commissioning group, to make sure that mental health receives parity of esteem with physical health, and that therefore the service delivery we have in Cornwall and the Isles of Scilly is one that we're all proud of.
The overall ethos of the team in terms of addressing all aspects of somebody's life and care and getting them back to whatever it is that they want to be doing just seemed like a fantastic way of working.
What I really liked was the small caseload element of working in the early intervention team, the fact that you can actually do more work with your clients as individuals.
One guy in particular, he's gone from being a shallowing man to, it's amazing. You see him, he's going to work, he's looking after his children, he's striving forward every day. And it's just, you get a nice warm feeling when you see that side of things and when you see these people getting better and moving on with their lives.
The therapeutic relationship that we built between myself and my psychiatric nurse was the most important thing. That was the most important thing for me, to be able to trust her enough to open up and tell her about my symptoms, hearing voices, seeing things. It's not easy to say that to someone, so to have that relationship between her was very, very important, and I wouldn't have got better if I didn't have such a good relationship. I think there would have been a few more difficulties.